Hello, I'm Chris Foster, and I will be presenting this webinar on the Conceptual Framework, how AOK Networks improve child and family outcomes. So our objectives for this webinar are to explain how AOK Networks create better outcomes for children and families by improving the service delivery system. I also hope that by the end of this webinar, you'll be able to describe the critical role of network capacity for systems improvement. So first, what are AOK networks? AOK networks provide the most comprehensive cross-sector forum for early childhood and family support champions to work together on issues that promote the health and well-being of all young children and their parents or caregivers. AOK networks focus on system improvements to create better outcomes for all families with young children. In our 20 years of existence, this has been who we've been since the beginning and continue to be. However, there have been some changes. But first, a little history. So in 1999, the Illinois Department of Human Services drafted a paper called the Assuring the Well-Being of Children Ages 0 to 3. A couple of the big ideas in that concept paper was that we wanted to make sure that babies, young children, and their families receive the services they need, and that we wanted to ensure a comprehensive continuum of services are available within each designated AOK area. So while this has remained the same over the years, including most of the original core components of an early childhood system, we've also made many improvements over the years. For example, early on we were focused on birth to 3, but over the years as the science led to a realization that it was important to bridge into the public school system and entry into kindergarten, we broadened that focus to be 0 to 5. We've also developed many essential frameworks to guide our work. Starting from a concept paper, there was much to develop and evolve over the years. This conceptual framework is one of those frameworks, as well as the developmental pathway is another example of a framework that's been developed to further guide our work. We've also deepened our commitment to locally defined initiatives within a statewide framework. Since the beginning, the AOK Networks project has provided certain frameworks or parameters for what it is that AOK networks are focused on, but have always relied on networks to engage in a local assessment and planning process to determine the local needs, priorities, and solutions that will work in their communities. This is a critical piece of AOK Network's philosophy that only local communities can fully know what's going to work in their community. We've also enhanced our ability to track our efforts so that we can learn from what we're doing and continually improve, not only in individual communities, but as a program as a whole. We've evolved the importance of the network capacity for system improvement. When we first start out, we did not have a full understanding of the critical role the collaborative played in making the service delivery system better. Over the years, through experience and research, we've come to realize just how important it is to develop that capacity, because without that capacity, we don't have what we need to make those system improvements. We'll talk more about that later. And then another just for today is just this idea that we have allocated more resources and support for comprehensive information and referral systems in each AOK community. So we continue to seek out the resources and supports that are needed so that we can develop better early childhood systems in each of our AOK network communities. So let's get to the conceptual framework. Here you'll see our graphic that represents kind of the big idea, if you will, of what it is that we do to improve child and family outcomes. You have access to a 3-page document that includes this graphic as well as 2 additional pages that give more details about the specifics behind this conceptual framework, and I will be going through those details today on this webinar. So for now, just know that the conceptual framework is a visual explanation of how we intend to create better outcomes for young children and their families. And the big idea behind this conceptual framework is highlighted in these gray bars across this graphic. It starts on the left with this idea that we must build network capacity so that we can continuously improve the local service delivery system so that system outcomes are improved and more children are positively impacted. So this is the framework that guides our efforts, and we will use the rest of this webinar to unpack this to better understand that big idea. So you'll note that on the top of the conceptual framework is our mission. So that mission here is reflected on this slide. And you'll note that this mission is divided kind of into 3 parts that indicates kind of what we are, and that's community-based collaborations. The results that we're after, which is healthy pregnancies and the positive growth and development of all children birth to 5 and their parents or caregivers. And how we do this is by assuring a well-coordinated, easily accessible, equitable, and just system of services and supports that engages parents as partners in making the system work for them. While the articulation of this mission has evolved over the years, what has always been central is this focus on improving outcomes for children and families through a systems approach. One additional way kind of we answer the question of what and how we do what we do is through a set of 3 principles. These principles are highlighted on the AOK Networks website. You can see a great little graphic video that highlights these 3 sets of principles, but I'm going to go ahead and touch on them again today briefly. And you can reference your 3-page conceptual framework document for more details on each of these as well. So our 3 principles are focused on community engagement, which are principles that help AOK Networks partners increase their capacity to work well together and to be effective together. The family support principles help service providers respect and honor parents and caregivers' inherent strengths, wisdom, and capacity to care for their families. And the system building principles guide us once again in building a comprehensive system of services and supports that meets the needs of children and families. So let's look at each of these sets of principles a little closer. The community engagement principles are actually come from a set of work that's referred to as the 12 key principles for creating healthy community change. And these principles are principles that can, again, help us work well together and be effective in what we do to improve that service delivery system. And so these principles can be very empowering, especially when we see them come to life in our collaborative efforts. And so we can use these principles to not only guide our efforts, but to really think about and invite everyone's leadership. That we can think about these as we think about how we're going to convene meetings and create conversations that really matter and that can lead to change. And just how we think about community change in general. So for example, as I pull out a couple of these, the first principle, people support what they create. We can all, I'm sure, relate to this idea that nobody wants to be told what needs to be done and how to do it. But when we're engaged in that process of figuring it out together, when we co-create, then we automatically have more engagement and involvement and commitment to that when we've helped create it. And so that's an important principle, as are all of these. Another one that stands out is right below it, Principle 5. Expect leadership to come from anywhere. When we're working on complex system issues, we need leadership from all parts of the system. And whether that leadership comes from providers, whether it comes from residents or community members, or whether it comes from some of the families who are most experiencing the problems that we're trying to solve, we need to invite that leadership from everywhere and expect even those that we least expect to be leaders to be in the process, because sometimes it's those leaders that have the most insight on what needs to change and how it can be changed effectively. I also like principle number 3. Conversation is the way humans have always thought together. In conversation, we discover shared meaning. I think this is really important when we're thinking about how do we get to shared understanding of problems, and how do we get to shared understanding and shared commitment to action around these problems. Without good conversation, it's nearly impossible to get there. And so how we structure our conversations, how we convene our meetings, has everything to do with how we're able to engage people and be more effective together. So all these principles are really powerful principles, and I invite you to take a closer look at them on your 3-page conceptual framework document. The next set of principles are referred to as family support principles. And again, these are there to help us, not only individual providers, but for all of us to remember to respect and honor parents and caregivers, their inherent strengths, their wisdom, their capacity to care for their families, because we all have these capacities, and it's important to build upon those. And so some of the principles in this family support section include, affirming and strengthening families' cultural, racial, and linguistic identities and enhance their ability to function in a multicultural society. To remember that families are resources to their own family members, to other families, to programs, and to the community. And to remember too that as staff, we can enhance families' capacity to support the growth and development of all family members. And so it's these kinds of principles that help us not only work more effectively with the families in our community that we're trying to serve, but as a network, we can also create a system that's based on these principles so that families, anywhere they go in the system, know that they are respected and their strengths are identified and built upon as they work to solve or resolve problems that they're facing. The last set of principles are called system building principles. And again, these guide us in improving our service delivery system. In a way, they provide a vision of what we want the system to be like. And so many critical and important principles here, but just to highlight a few, again, related to the family principles, we also take a strength-based approach here. We want a system that builds upon the strengths of families. We also want a system that's holistic. The system is comprehensive and addresses the full range of a young child's developmental needs, as well as the needs of the family. We also want the system to be culturally sensitive, that it's respectful, and sensitive to the diverse needs of families. And of course, we want it to be coordinated so that it's aligned and connected so that families can easily access the services that they need when they need them. So these principles really are embedded and cut across all the work of AOK Networks, and I hope you'll take a few minutes to take a closer look at all these principles in that 3-page document. So let's move on now to the heart of the conceptual framework, and let's focus in on network capacity. As you'll see here, AOK Network partners work together to build their collaborative capacity to continuously improve the service delivery system by focusing on 4 core areas, and that includes shared agenda and goals, collaborative leadership and engagement, continuous learning and adaptive action, and network governance. And in a moment, we're going to dig a little bit deeper into those. But for now, I want to stick to kind of a broader definition or way of thinking about network capacity. So one aspect of network capacity is just that we have a broad and diverse set of stakeholders representing all the sectors that care about the health and well-being of young children and their families. So without this engagement, without this cross-sector involvement, we have limited capacity to meet the full range of needs that children and families may have for the services and supports that we can offer. Network capacity also refers to this idea of building the collaborative ability, knowledge, and will to work together across sectors to meet the needs of children and families. So there's a broad range of knowledge and skills that we need to be able to work together. But what really hopefully brings us together is this idea that we all care about the health and well-being of families with young children. And while we each may focus on a different aspect of that health and well-being, together and only together can we actually meet that full range of needs. And so together, we need to learn or build the capacity to work well together across sectors. And so we know that without this capacity, we can do very little to change the service delivery system. So let's take just a little closer look at these 4 network capacity areas. Again, there's more on this on the AOK Networks website, and there's some other tools and resources available to coordinators on this. And some of this is defined briefly in the 3-pager. So just at a high level, I just wanted to share a few things here. When we talk about a shared agenda and goals, what we're really talking about is that there's some shared understanding of network partners around the system building, our mission, and this framework about how we generally what we're here to do together, but then more specifically, it's also about having some buy-in and commitment to our more specific local initiatives that we're doing to help build a better service delivery system. So whether that's around our network capacity initiative, our system building initiative, or our child and family initiative, we've got some shared understanding and commitment to those agenda and goals. Collaborative leadership and engagement. This is at essence is about taking individual and organizational responsibility for carrying out the network's shared agenda. We know that we can't be successful unless we have active commitment, not only by individuals, but by organizations as well, to solve or to achieve our shared agenda. And so this has a lot to do with the idea that everyone that participates is a leader, and how do we all contribute our leadership in ways that create a synergistic kind of result that can't be happened from engaging only a few people. Continuous learning and adaptive action, it refers to a couple different things. In general, it refers to this idea that we have to be continually learning what's working and what's not, and then figuring out how we can adapt our efforts to move us closer in the direction that we desire in terms of our shared agenda. So this is applicable kind of at the big picture level from when we do our assessment and our planning, and then we move into action. But it's also on a smaller level as we begin to engage in specific strategies or approaches in our strategic plans. And we start out to take action on a strategy, and we pay really close attention to what is and isn't working, to other unintended consequences that result from our actions, so that we can be quick to learn and adapt so that we can keep us moving in a direction towards the goals that we've defined. And then finally, network governance really has to do with making sure that we have established, our key functions, structures, and processes that allow us to collaborate and build that system of service and support. So there's a lot more on each of these, again, in some of the other documents that you have available to you. And I hope you'll take some time to kind of dig into those, because for each of these 4 core areas, there are a number of different elements that further break this down into very tangible pieces and parts. All right, so now that we've looked at network capacity, let's move on to look at how we continuously improve the local service delivery system. As it says here, we use a 3-prong approach to address system issues and continuously improve the service delivery system. There are 3 different approaches. One is using human-centered design, another is system building, and the third is system change. And then embedded in all of this is this idea of continuous improvement and adaptive action. So let's take a closer look. With system improvement, what we really mean here is that we use a system approach to address the system issues that get in the way of babies, children, and families reaching critical outcomes. This is our graphic we use to illustrate this. So let's break this down a little bit more. So why do we even need a system approach? Well, the bottom line is that complex system issues prevent families from accessing equitable and quality services. So sometimes, even when we're using evidence-based interventions to achieve the outcomes that we're after, in this case, we're looking at if we want to make sure all kids are kindergarten ready, as we know from our developmental pathway and what we know from our own experience and knowledge, is that kids need to meet a number of developmental milestones over time in order to be kindergarten ready. But as we also know, sometimes not all kids are meeting those benchmarks. And so the earlier we can detect that, the better we can help support getting back on track. So often an intervention that is done in our communities are developmental screenings. And so this makes a lot of sense when we think about it in just the basic. If we want to help more kids be ready for kindergarten, one of the best things we can do is make sure we're doing those developmental screenings. We can identify children early who are not meeting those benchmarks, and then we can get them connected to services to get them back on track. So while that is simple in theory, and it makes a lot of sense, the problem is there are often system issues that get in the way of those developmental screenings from taking place or actually supporting children. So let's take a look at a couple examples. So for example, and this is hypothetical, but what if some agencies are not referring families to agencies that actually screen? What if screenings are not offered when and where families can use them? What if the kids who could most benefit are not being screened? What if some agencies don't believe it's their role to talk to parents about screening? What if parents are not involved in understanding and addressing screening access issues? And what if some agencies offering screening do not use trauma responsive practices? These are examples of the kinds of system issues that can get in the way of even the most evidence-based interventions that we can offer. And so this is why we need a systems approach. We need to focus on addressing these kinds of issues that get in the way of the good work we're trying to do. So just kind of looking forward for a brief moment, and then we'll come back to this. When we're looking at system improvements, what we're really trying to do is to improve access to quality services. We're trying to increase the coordination of all our efforts, individual efforts of agencies and organizations and by sectors. We're trying to create a more equitable and just system. And we want to engage parents as partners in making the system work for them. So these are some of the kinds of system issues that we're going to look for. Where is there a lack of access? Where is there a lack of coordination? Where is the system not equitable and just? Where are we not engaging parents as partners? These are the kinds of things that we look at as we try to improve the local service delivery system. And so another way to look at that graphic in the center of the conceptual framework is to just really focus in on the three approaches that we use when in our systems approach. And so this includes human-centered design, systems building, and systems change. And of course, all of this is embedded within an ongoing process of continuous learning and adaptive action. You'll learn more about this in the webinar on our system approach more broadly. But for today, I just want to emphasize just and define what each of these are. So human-centered design, as you're probably familiar, is just this idea that we believe that the people who face the problems every day are the ones who hold the answers to their key. So at the essence of this is just this idea that if those that are facing the problem, they are the ones that we need to be also engaging because they have a unique perspective on the system, how they're experiencing it. And as providers, we cannot fully understand that because we're not parents trying to navigate the system. So engaging them in the process from the very beginning to understanding the child and family problems, to understanding the system issues, to designing strategies and implementing and making sure what's working and what's not. They have a critical perspective, as do the other providers who are also experiencing problems within the service delivery system that limit their ability to serve families. So we need to think about all those that are involved in the problem and engage them deeply in the process of figuring out how to solve it. Our system building approach has kind of two different aspects to it. One aspect is the early childhood system components that comes from our initial concept paper that back in 1999. In that concept paper, it outlined these different components and why we've called them different things over the years. These are the pieces of a service delivery system that we believe are important to helping it function well and serve families to the greatest it can. So things like early identification, that we're ensuring screenings and assessments are taking place both prenatally and for postpartum parents, as well as for young children. Public information and education, that we're continuously sharing information and educating not only providers and families, but the general public about the importance of the early years and parents' central role in helping their children develop to their fullest potential, as well as providing information and education on very specific issues that families may be facing at any point in time. Information and referral we're all quite familiar with, but how do we make sure that families, providers, and the community have the information that they need and are connected to the services and resources that they can through a system-wide referral process that includes a feedback loop so we can ensure no one of those falls through the cracks. Service needs and utilization is just a fancy way for thinking about how are we monitoring the service availability and the needs and use of those services to assure that there are adequate services to meet families' current needs. Workforce staffing and development. This is also probably pretty clear, but how do we make sure we can again use those family support principles to assure that the whole early childhood system has the knowledge and skills they need to address the problems that we are currently focused on in our initiatives. And then finally, state and local policy. How can we address those policy issues through information sharing and education and advocacy to the extent that that's appropriate. So on the one hand, we think about system building as looking at these components and assessing the extent to which these things are currently happening, and then figuring out what more might need to be done or built or changed in order to make those components function well. We also build upon a system building kind of focus by adapting best practices from other places, while we always make sure that the best practices we use are customized to our local community. We don't always have to recreate the wheel, and we can look to see how other communities have solved similar problems and then adapt it for our use. We can also build on the local strengths and assets in our community. We've used community asset assessments. We've done appreciative inquiry and other ways of really identifying and building upon those strengths and assets. And then also collaborating and aligning with other related local efforts. Because we're focused on early childhood, we have a scope in which we focus our efforts. And sometimes, though, we find that there are other issues, whether it be transportation or access to healthy food, that may be outside of what we would normally focus on, but we can work and align our efforts with others in the community who may be addressing those issues across a broader spectrum for all families with children ages beyond birth to 5. Another approach that we use is the system change approach, which seeks to permanently change how the system functions and behaves. So this is a little bit different from system building, which tends to be more about building up of something that doesn't exist or building upon actual or existing resources. For systems change, it's a little bit different, and that's defined as altering the status quo by shifting and aligning system parts and their interactions so the system acts in new ways. So at the heart of this approach is really influencing how people in the system behave, so their practices and their habits. For example, how they do referrals. Do they do follow-up after they make a referral? There's probably practices and habits that are already in place that may or may not be working. The other part that a systems change approach attempts to do is to influence how the system is structured and how it's functioned. And so often we think about this in terms of how we're coordinating among the parts of the system and how we're aligning those efforts. So a system change approach is really characterized then by designing strategies that target system root causes, which represent really powerful leverage points in the system, that when we change these certain leverage points, it can have a ripple effect, if you will, across the system. And so we do all of this by engaging diverse stakeholders to understand the problem, designing and implementing strategies that target these root causes. And then because we never know fully how a system is going to respond, We have to continuously pay attention and learn what is and isn't working, and then adapt our efforts until we reach the desired results that we're after. Now, as we said at the beginning, all three of these approaches are embedded in a broader approach, which is what we refer to as continuous learning and adaptive action. This is also referred to as action learning in some places outside of AOKs. But what this really is an iterative process where we're continually making our efforts more powerful and effective and scalable through small cycles of preparing, implementing, learning, and adapting. And we can apply this at the level of an initiative. We can apply this at the level of an objective in our plans. We can apply this at the level of a specific strategy or approach. We can use this across the different phases of our assessment, planning, and action process. But the idea is that we start somewhere, we try it out, so we prepare, then we implement it or take action. Once we've done that, or as we're doing that, we pause to learn what is working and what isn't. And then we figure out what, if any, ways we need to adapt what we're doing to continually move us towards our goals and our objectives. And so sometimes this happens in multiple cycles. Maybe it's 2, maybe it's 3. It could be even much larger than that. It depends on the scope of what you're looking at. But what's important to understand for today is that we can never really know what's going to work when we start trying to shift a system. And so whether we're system building, whether we're using system change, the degree to which we're engaging in human-centered design, continuous learning and adaptive action will always be part of what we're doing. All right. So now let's focus more specifically on those system outcomes that I referenced earlier. Again, when we're trying to improve the service delivery system, these are the ways in which we're trying to improve it. We want to improve access to quality services. We want to improve coordination of our efforts. We want to make sure that the system is equitable and just. And we want to engage parents as partners in making the system work for them. So let's look at each of these a little more closely. So access to quality services. What this means is that more families have reasonable and affordable access to an array of quality services and resources that promotes their children's development and meets their family's needs. So some examples of this is that, first of all, we want to make sure that the services and supports and programs that we offer in our community match up and meet families' needs. We also want to assure that there is a sufficient array of services for any one type of service. That one type of service may not meet every different type of family's needs in our community. So are they culturally relevant, for example, to every family in our community? Are the languages that they speak at home also spoken when they're receiving services? Services are affordable. Obviously, that's a major roadblock to accessing services if they can't be afforded. We also want to make sure services are located at times in locations that are work for families. And finally, we want to make sure that the eligibility policies and practices are equitable so that we can assure that families are getting connected to those services. Coordination of efforts. More families experience a coordinated, cross-sector system of services and supports that are holistic, aligned, and easier to navigate. So quite a few examples here, and coordination can happen on a continuum, right? From low levels of coordination to much higher levels of coordination. But in all of them, we hope that there is some degree of shared agenda and goals. Again, going back to one of our core network capacity areas, it's very difficult to coordinate our efforts if we don't have a shared agenda or goals. We also need to have a collective understanding of system of problems. Sometimes it's really hard to get a shared agenda and goals because not everyone understands the problems that are involved. And so the more that we can engage everyone in those understanding those problems, the easier it is to get to collective understanding of it. Communication is a big part of coordination. What's the communication look like between agencies and sectors, not only in meetings, but between meetings, and as it has to do with connecting families to services. What's information sharing looking like on a case-by-case basis and a much broader initiative effort? How are we sharing information, data, and things like that? What's service coordination for the same families when multiple agencies are all working for the same families? How do they coordinate that service? As we all know, that can be a real challenge. Effective referral processes, I don't think much needs to be said about that. And of course, another way we can coordinate is combine our resources, whether those are in-kind contributions or actual pooling of financial resources. It's sometimes necessary to be able to tackle some of the bigger things that we hope to do in our communities. Equitable and just system. More families experience an equitable system that assures all families have a fair opportunity to receive what they need to be successful. So again, just a few examples. We want to make sure that services are designed to benefit all families, regardless of their circumstances. We all know that it's easier for some families to access services than it is for others for a wide variety of reasons. So we want to be aware of that and do what's needed to make sure that everyone has a fair opportunity to access those services. Barriers are removed so that all families have opportunities to participate, and promoting equity by supporting groups experiencing inequities to have voice and power. So just as we've talked about parents as partners, we want to make sure that those who are most experiencing the problems in our targeted problem frameworks are engaged so that we can understand what they're experiencing and that they can help influence what it is that's needed so that they too can access the services that will benefit them. And finally, parents as partners in making the system work for them. This is where more parents are welcomed, respected, valued, and engaged as leaders in their families and in their communities. For example, on one level, it's about honoring parents as children's first teachers. It's also about providing meaningful opportunities for parent leaders to develop their leadership potential. It's about amplifying parent voice in decision making. And it's also about engaging parent leaders as full partners in planning, implementing, and evaluating network initiatives. These are our system outcomes. And we believe that when we work to improve these system outcomes, that more children will be positively impacted in these areas of being born healthy, being safe, healthy, and developing positively, and being kindergarten ready. So let's take a closer look at these child impacts for just a moment. Again, these impacts are come from our developmental pathway, and you can see that document as well as the webinar on the developmental pathway to learn more about it. But for now, just know that that's a good resource to learn more. But let's look at these different impact areas. So the first one is babies are born healthy. And we measure this through outcomes such as more babies are born at a healthy birth weight, more babies are born full term, and there are fewer infant deaths. Now, there are other outcomes, obviously, that contribute to whether or not babies are born healthy. And for those details, you can see the developmental pathway that I just referenced. The next impact area is that young children are safe, healthy, and developing positively. Again, some example outcomes related to this impact area for healthy are more children are at a healthy weight, fewer toddlers and preschoolers have preventable dental problems. For safe, an example outcome is fewer children are abused and neglected. And for positive development, more children are meeting benchmarks for social and emotional development. Again, see the developmental pathway for many more outcomes related to this impact area. And then finally, all children are kindergarten ready. There are outcomes for this related to health, physical development, and kindergarten readiness. So a couple examples are that more children are meeting benchmarks or kindergarten readiness measures for active physical play and nutrition, and that more children are beating benchmarks for language and literacy development. So as I said, there's many more outcomes related to all of these impact areas, and we refer to those as child and family early success outcomes, and you'll find this in the developmental pathway, so you can look more there for more details. So to wrap this up, I hope that from this webinar, you now have a clearer understanding of how AOK networks improve child and family outcomes, and that you understand the important value of building network capacity in order to do that. And so I hope you'll feel comfortable explaining that we need to build network capacity to continuously improve the local service delivery system so that system outcomes are improved and more children are positively impacted. Thank you for your time. I hope this has been helpful.